Okay, so now today we will try to understand the different blood products. Okay. So what usually happens when if the patient goes in the blood bank and he gives almost around 500 ml of whole blood. They take out in the bag whole blood of around 500 ml. But then they process it. There is different processes, centrifugation and etc. etc. But in short, what they do, they separate the blood into two parts. So one part is the platelet-rich plasma, and the other part is the RBCs. So what do they do in the machine is they separate the red blood cells from the plasma. So the plasma has all the platelets, and this has the PEG cells. But then this RBC, they will make another blood product which comes to you, which is the PEG cell volume. And what is usually the volume of this PEG cell? Around 350. Okay. So why knowing the volume is important? Because you are giving a volume. Let's say when you give fluids, you ask how much normal saline should we give. So this also is a fluid. So you should always remember that you are giving the patient a fluid. So this is around 350 to 400 ml of volume. This platelet-rich plasma. What is platelet-rich plasma? It's the plasma. Apart from the red blood cell, everything in the blood is here. Then what they do is remove the platelets from this one. So one part will be platelets, and the rest will be plasma. So platelets again they can be used. And how much is the volume normally in the platelet bags? 280. Lala. There are small bags. If you collect the 6 volumes, there is more.
Yeah.
If it's single random donor units, they're usually like 50 ml. So if you're using 6, 300. So it depends what you are using. So generally, so what it means by random unit and single donor unit?
Random is from a couple of people.
Yeah. Usually, sometimes what they do, even the pool one, the single donor, sometimes they just pool and put it in one bag. So we are not sure if it's just from one. But ideally the other one, we call it single donor unit. Usually used in the transplant patients. This plasma, which is left over, what they do with this plasma is they freeze it. And if they freeze it, they call it fresh frozen plasma. And what does fresh frozen plasma contain? It will contain all proteins, coagulation factors, albumin, 1 millibrand, everything is there. What is in your blood? So if someone has coagulation factor deficiencies, you give them FFPs, it will replace. PTA-PTT is deranged, you give FFPs, corrected. Why corrected? Because all the coagulation factors are there. Factor 1, 4, 1, 2, 7, 9, everything. Again, what they do is that they spin it again and they call it precipitate, which is what they do from this solution. They will make two things. So one is fresh frozen plasma and the other is cryoprecipitate. Cryo means cold, precipitate, then it's after centrifugation they got this cryoprecipitate. What is cryoprecipitate? From all the factors, albumin, 1 millibrand, all of them, you will only get here factor 1, which is called what? What is the name of factor 1? Fibrinogen. Which we check in Peg asparaginase patient. We send fibrinogen level and the D-dimer level. So factor 1 is fibrinogen. So you will have fibrinogen. And more importantly, you will have factor 8. That's why we usually don't have hemophilia patients, but hemophilia A patients who are deficient in factor 8, you give them cryoprecipitate. And the third thing is 1 milligram. So if someone has von Willebrand deficiency, he's bleeding, you will give them cryoprecipitate. Okay. So when you process FFPs or not FFP, basically the plasma, when you process and you take out the cryoprecipitate, the other thing left is known as usually they call it supernatant. But this fluid has except factor 1 and factor 8, everything will be there. Tamam. Volumes are always very important. So we told you pack cell volume 350 ml. Yeah. Platelets 50 ml. Cryoprecipitate usually 50 ml. FFPs 250 ml. Tamam. So let's say, how do you replace in a person? How much you will give pack cell? How much you will give platelets? So generally in adult patients, we give them, so one pack cell will increase the hemoglobin from 1 to 1.5 grams. So it depends on our target. Tamam. Platelets usually in adults 6 units random, or which is equivalent to this one single donor unit. This is adult dose. Cryoprecipitate, you give 10 units. 1 unit for every 1 kg, 10 kg. So let's say patient is 40 kgs, you will give 4 units. FFPs, how do you replace FFPs? You give them 15 ml per kg. This is the replacement for FFPs. So 15 ml per kg. Even the red blood cells, the packed cells, in children we give it 15 ml per kg. It's the normal calculation. So whatever the weight, and you divide by 15. So let's say you need to replace 1000 ml. You will see one FFP bag is 250 ml. You will give 4 FFPs. But always you have to remember. Let's say if you are giving 4 FFPs to a patient, how much are you replacing? How much fluid you are giving to the patient? 1000 ml. So the patient is in fluid overload, or he has another problem. The patient could land in trouble. Why? Because you are giving 1000 ml of fluid. It's just like you are giving a bolus of 1000 ml. The blood should be given within 4 hours after it's out of the blood bank, after out of its refrigerator, because it's actually stored at 4 degrees centigrade in the blood bank. So once it comes out in like 24-25 degrees centigrade, it should be used within 4 hours. The most the source of infection for patients, most of it is mostly platelets. Why platelets? Because platelets, they are kept in the blood bank at 20 degrees centigrade. So at this temperature, there are more chances of getting infection. The bacteria can enter into the platelets. But usually blood, because it's 4 degrees, you will not have a lot of activity. Fresh frozen plasma, it also is very low degree. Cryoprecipitate, they are all, sometimes they are even stored at like -20 and -80 degrees centigrade. So these are more or less the things. For packed cells, we need to have a match. For platelets, match means it should be group specific. So if someone is A, he can only receive A, or he can receive what? He can receive B? No. He can receive O? Yes. O can receive A? No. Why? It's a very basic concept of antibodies. So what happens? Just for you guys' revision, we have a tissue. So, so what happens? See.